So health officials say our herd immunity is rising with the rapid spread of the Delta variant. News 9's Erica Rankin breaks down where we are and what doctors predict we could see in the coming months.
Epidemiologist Aaron Wendelboe says community immunity or herd immunity, he estimates in the state, is at about 78%. That's up from where it was in July at 61%, but he believes that will begin to wane in the next couple of months.
It doesn't look like population immunity is really going to last much longer than a year.
Our nearly 80% of herd immunity can be chalked up to the rapid spread of the Delta variant, people who have been vaccinated and never got COVID, plus the nearly 600,000 cases we've had in total in Oklahoma.
Let's say that for every one person that had a test done that was positive, there are 3 people in the community that got infected. So that would be 2.4 million people.
Experts predict that once that immunity starts to decrease, we could have another spike in cases in the late winter or early spring.
For the longest time, people said, once we get to herd immunity, like, we're good, our lives are going to go back to normal. And so I didn't want to convey a message that we get to this herd immunity and then it just stays there forever.
Doctors say that timeline, though, is contingent on one thing.
Will we see a different variant?
Dr. Bretzler hopes as Delta begins to burn out, we will see a continual steady decline in our hospitalizations. But he says we are reaching a grim milestone of 10,000 deaths from COVID-19 here in the state. That equals out to about 1 in every 400 Oklahomans has died of COVID-19. That's higher than the national average that sits at 1 in 500 Americans. In Oklahoma City, Erica Rankin, Oklahoma's Own, News 9.
All right.